Okay, here we are after the second spin. Doors open automatically. And I take my conical out. Now, you can see at the bottom that all my platelets, my buffy coat, is at the bottom and it's stuck on the bottom. And that's the way it should be, that we actually have a very nice buffy coat at the bottom. So what we're going to do is take a 30 to 60 ml syringe. You have both in your kit. And we're going to remove the platelet pore plasma. And you can see right here on the side, gives me an idea of how much will be left here in the separator tube. And so depending upon what procedure I'm doing, I want to leave 10 mLs in there or 7 mLs in there. And we're looking at 4 to 6 times baseline when we come up with 10 mLs of platelet-rich plasma. Okay, so this platelet pore plasma I'm just going to dispose of. Then I'm going to take my 10 or 20 ml syringe, whatever you're using. I'm going to put it on there, and I'm going to very gently shake and stir so I can resuspend the platelets in the serum or in the plasma. Okay, so once all those sticky. All right, now I have a very, very rich, platelet-dense product. And I can pull it into my syringe, and I can go ahead and do my procedure. All right, and I have my platelet-rich plasma. And if you were to have washed the red blood cells out of the little tubing after the first spin, you would have a very yellow plasma like the platelet pore. Okay, so either way, this is typically fine. Sometimes physicians will choose for no red blood cells, and that's one of the beautiful things about this EMICYTE system, actually, is that you get to decide, and you have a very high yield anti-inflammatory platelet-rich plasma. Now, when we do rejuvenation or regeneration type procedures, regenerative procedures, we're injecting this platelet-rich plasma into a non-injured tissue. For instance, when we do an O shot or a Priapus shot. So I have to activate my platelets, and I do that with calcium chloride, calcium gluconate. I prefer the calcium chloride, but I always have some calcium gluconate on hand in the event that I have some trouble getting the calcium chloride. The calcium gluconate doesn't need to be refrigerated and has a much longer expiration date as a result. So anyway, I add about 10%, or rather, 5% of the calcium chloride to my platelet-rich plasma just before I inject. So I'm activating the platelets so that they spill their growth factors. Now, what I have also found is that many people, although this is a physiologic pH, this product, many people will have significant discomfort based on their own pH. So I buffer the plasma with, again, approximately 5% of the volume of sodium bicarb. So in this particular case, if I have 10 mLs of PRP, I'm going to put in 1/2 ml of bicarb. I can do that anytime. It doesn't activate the platelets. And then just before I inject, I'm going to add another 0.5, or 10% of the volume, 0.5 mLs of calcium chloride, 10% solution. All right? So I'll actually end up with 11 mLs in this syringe. And that'll be great.